Hello, and welcome back. In this chapter, we're discussing the disruptive, impulsive control, and conduct disorders. In this section, we have individuals who have problems in emotional and behavioral self control and tend to have first onset in childhood or adolescence. The diagnosis is unique in that individuals' problems are shown in behaviors that violate the rights of others and bring the person into conflict with societal norms and authority figures. These individuals have a real issue with following rules, um, being safe in environments, and having problems with dealing with relationships and actually meeting societal norms. So guidelines to explore cultural influence of the symptom picture. We need to assess for lifestyle behaviors, expected standards and behaviors, and everyday activities. Comprehend meaning, labels, and interpretation commonly used to describe a child's behavior and emotional problems. Evaluate the cultural context of what on the face of it appears to be, as an illness behaviors to determine whether the essential support a DSM-5 diagnostic criteria. Determine whether the diagnostic criteria are valid for the specific population to be assessed. Consider the child and the parents, threshold of stress and how they cope with the child's behavioral problems. Recognize how the clients perceive their practitioner's social position. Be self-aware and pay full attention to the client's cultural background. Our first disorder is going to be oppositional defiant disorder. This is characterized by a pattern of disobedient, hostile, and defiant behavior towards authority figures, which goes beyond normal childhood behavior. Must show at least four symptoms from any of the three categories. And the three categories are angry or irritable mood, which can be frequent loss of temper, touchy or easily annoyed, or are often angry or resentful. Remember, these go above normal childhood behavior. Argumentative and defiant behavior, arguing with adults or other authority figures, with being non-compliant, annoying others, or blaming others for mistakes or misbehavior. Vindictiveness, spiteful and malicious, at least twice within the past 6 months. And behaviors must cause some level of impairment in key areas of functioning, such as interpersonal relationships or in school. Symptoms of ODD. These behaviors can be seen on most days for at least 6 months for children under 5 years of age. For those who are years of age or older, the behavior should occur at least once a week for the last 6 months. A psychotic substance use, depressive or bipolar disorder does not explain the symptom picture. And severity is mild, moderate to severe. Intermittent explosive disorder. The features of IED is distinct episodes of failure to resist aggressive impulses that are evident in verbal aggression, like temper tantrums, tirades, arguments, or physical aggression, fighting with others. Seeing an explosive outburst wherein the person is unable to control his or her aggressive symptoms. Happens about twice a week for at least 3 months, so that duration is really important to capture. Person may be involved in more serious assaultive acts that may cause injury or destroy property. Are out of proportion to any provocation or participating stressors. Premeditated causes distress, seen in individuals as young as 6 years of age, and not better explained by another mental disorder. Conduct disorder. The essential feature of conduct disorder is a consistent pattern of violating the rights of others or major age appropriate societal norms or rules violated. Tend to be seen before age 15. If 18 years or older, criteria may not be not met for antisocial disorder. Requires the presence of any three of the following 15 symptoms, which there are four major categories. For at least 12 months, one symptom is present over the past 6 months. Aggression to people or animals, there's 7 symptoms. Destruction of property, there's 3 symptoms. Deceitfulness or theft, there's 3 symptoms. And serious violation of rules, there's 3 symptoms. Causing social, occupational, or educational impairment. The specifiers are onset severity and with prosocial emotions. Now, the difference from conduct disorder and ODD is going to be the lack of remorse shown from an individual with conduct disorder. These individuals, this is a lot more severe than ODD, and this is a rare disorder because again, this is kind of a prerequisite for antisocial disorder as an adult. These individuals have the intent to do harm and show very little or to no remorse for their behaviors. They have the intent to do bad. They have the intent to disrupt social norms and rules. They have the intent to harm. So a lesser known disorder, pyromania. The essential feature is the deliberate and purposeful setting of a fire on more than one occasion, and experiences of tensions of emotional arousal before setting the fire, fascination, interest, or curiosity about or attraction to fire or a situational context, a sense of relief experienced when setting fires, witnesses in its effect and participating in the aftermath, no motivation for setting the fire, a better explained biconic disorder, and not better explained biconic disorder or manic episode or antisocial personality disorder. Kleptomania. Central feature distinguishing kleptomania is this is a rare disorder. Is the individual's inability to resist stealing from someone else or somebody else's property, right? It has no personal use nor or monetary value to it. So they steal things that have no value. Experiences a sense of tension just before the theft. Feels a sense of relief or gratification at the time of the theft. Not done to express anger or vengeance or part of delusion. So there were some changes made from the DSM-4 to the DSM-5. ODD and cognitive disorder were removed from the DSM-4 chapters. Disorderly usual first diagnosed in infancy, childhood, or adolescence. Intermittent explosive disorder, pyromania, and kleptomania were moved to this chapter from the DSM-4. And while antisocial personality disorders is listed in this chapter, it is further elaborated in the chapter on personality disorders that we covered earlier in the semester. Symptoms for ODD are the three types that we discussed. For the most part, diagnostic criteria for cognitive disorder remain unchanged, but a specifier was added with pro-social emotions. Individuals over the minimum of at least 6 years of age may be diagnosed with intermittent explosive disorders without outbursts of physical aggression that are not better explained by another mental disorder.